Afternoon, everyone. I'm Matt Crowley, the Chief Operating Officer at Florida Medical Association. Thank you for joining our webinar today. This will be the first of a few webinars we're going to have. We'll be doing another one next week on HIPAA in the time of COVID. Hope you'll join us on that as well. After our presenters today, we'll be having questions. On the right-hand side of your screen, there should be a box that you can type questions into. Feel free to type those in at any time, and we will be going through them as soon as everyone is done presenting. And with that, I will turn everything over to Dr. Ronald Giffler, FMA President.
Good afternoon. This is Ronald Giffler, your FMA President. Welcome to this webinar. Every day comes with another reminder that our nation is in an unprecedented healthcare crisis. While most Americans are locked down in their homes, doctors are fighting on the front lines. Emergency rooms are stretched dangerously thin, and Americans everywhere are sheltering in place. But beyond these headlines, America's healthcare system is facing a long-term financial crisis. It threatens to destroy our ability to provide care for years to come. The vast majority of doctors across the country are seeing patient volumes drop dramatically. Officials have ordered physicians to cancel any procedures that can be put on hold. Although these steps are crucial to stopping the spread of this deadly virus, they are creating a crisis for doctors. When patients aren't coming through the door, doctors are losing the revenue that keeps them in business. With patient volumes down and elective procedures canceled, doctors and healthcare workers are being furloughed in large numbers. According to data from the Bureau of Labor Statistics, almost 43,000 healthcare workers lost their job in March alone. Small family-owned practices are bearing the brunt of the pain. A recently released study from the American Academy of Family Physicians estimates that more than 60,000 family practices could close by the end of June, imperiling the jobs of 800,000 healthcare workers nationwide. Larger practices are also not immune to this financial disruption. Even some of our largest healthcare systems are under immense strain. But it's not just doctors and healthcare workers who are suffering in this new reality. If our practices cannot remain financially viable, reduced access to health care will hurt patients all across the country. Last month, Congress passed the CARE Act, a relief bill of more than $2 trillion to help us all weather this storm. More aid may be on the way, both from legislative and regulatory arenas. In fact, more aid has come just this morning to many of us. The mission of the Florida Medical Association is to help physicians practice medicine. To this end, we have assembled this webinar to provide guidance on the resources available to keep us afloat in these challenging times. Our first speaker will be Jarrod Fowler. Jarrod is the Director of Healthcare Policy and Innovation at the Florida Medical Association. His primary responsibility is to analyze state and federal policies affecting the practice of medicine. Additionally, Jarrod serves as staff to the FMA Council on Medical Economics and Practice Innovation. Jarrod's portion of today's webinar will include options available to physicians for financial relief during the COVID-19 pandemic, including the Payroll Protection Program, Medicare advance payments, and additional federal programs and regulatory changes that the FMA has been advocating and closely tracking through its federal lobbying team. Next will speak Jeff Scott. Jeff Scott is the General Counsel of the Florida Medical Association. He handles the legal affairs of the association and is extensively involved in representing the FMA before the Florida legislature and the executive agencies. Jeff will provide a brief summary of the executive actions of the governor and the Surgeon General during the COVID-19 pandemic and how these actions affect your practice. Jeff will also discuss the efforts the AMA has taken to assist physicians during this crisis. So without further ado, Jarrod.
Thank you so much, Dr. Giffler. And thank you to everybody who's in attendance today. I understand that this is an unprecedented crisis, as our president said, and I understand that many of you are like we are here at the FMA, information is coming in at a mile a minute, and there's just a lot to keep track of. I want to preface my remarks just by noting that many of the programs that we're talking about today are, quite literally brand new. Not only was this $2.2 trillion CARE Act, an enormous piece of legislation with many provisions, but it is being rolled out at a, at a speed that is highly unusual. I hate to use the word unprecedented again, but perhaps unprecedented in the sense that the funds under this program and its many provisions are being implemented on an almost immediate basis. And consequently, it will be very important for you to continue to monitor for updates and information from us as we move forward, as more information may become available. Today, I am very pleased to share with everyone on the phone some very good news. So when the CARES Act was passed, it included $100 billion in funding that was provided essentially to HHS to distribute to assist medical healthcare providers at the Secretary's discretion, which could include funding for grants to provide financial relief to physicians who have been affected by COVID-19, along with other healthcare providers, such as hospitals. Well, today, HHS announced that it is going to be dispersing the first $30 billion tranche of that money. And this funding will be made available immediately. Some of you may have already seen it in your bank accounts this morning. And this money will be available to all Florida physicians who received Medicare fee-for-service payments, that is Medicare Part B payments, in 2019. HHS has noted that these payments are not loans. These do not need to be repaid. However, certain terms and conditions will need to be accepted. And the approximate value of these loans is equal to 6.2% of a provider's Medicare fee-for-service billings in 2019, as calculated by a formula provided by HHS, which is to say roughly $62,000 for every $1 million in Medicare payments in 2019, or, again, roughly 6.2% of the total Medicare payments received by CMS in 2019. Again, this is a something that was just announced this morning, but it is absolutely tremendous and welcome news to many physicians here in Florida. These automatic payments will be provided by United Healthcare, which is contracted with CMS to make these disbursements, and they will typically show up as HHS payment in the payment description. Many physicians, again, have noted that they have already received these payments, and providers who normally receive a paper check for reimbursement from CMS will receive a paper check in the mail within the next few weeks. Now, there is one condition, which is that within 30 days of receiving these funds, providers must attest to confirming the receipt of the funds and agreeing to the terms and conditions of the payment. HHS will provide a portal for signing the attestation open the week of April the 13th. Again, these conditions here will be important to read over, but it's important to note that once the terms and conditions are accepted, again, this is effectively a grant. This is not a loan. This is money that will not have to be repaid. And this is something we've also very strongly supported as an organization. Ever since it was announced that $100 billion in funding would be provided through the Public Health and Social Services Emergency Fund administered by HHS under the CARES Act, we have advocated for dispersing more money to physicians. It is really a top priority as so many practices are struggling, and as keeping Florida's physician workforce solvent is enormously important to the health of patients and to just the needs of our entire economy, our entire healthcare system more generally. And so this is a step in the right direction. We are still reviewing and have some concerns around some of the terms and conditions provided for by HHS that are in line with this payment, including some restrictions on surprise medical billing, or what is normally known as balance billing for patients for care related to COVID-19. But nevertheless, we are very much hopeful that these funds will help physicians across the state of Florida who are struggling during this time of crisis. And we to providing even more information in the near future. Some other important pieces of information here, though, that I do want to review very briefly before we move on to our next topic, is that it's important to note that exactly how these funds will be distributed will depend on what type of practice you're in. All relief provided under this program will be made using the tax identification number, or TIN, of the provider. It should be noted that solo practitioners who bill Medicare will receive the payment under the TIN they use to bill Medicare. Physicians in a group practice should look at the part of their organization that bills Medicare to identify the details on the Medicare payments in order to understand how that relief will be provided. Basically, HHS notes that group practices are unlikely to receive individual payments directly, as the group practice will receive relief through these payments as a billing organization. And so just understanding, essentially how your organization bills for Medicare to identify where those payments will be sent will be important. Employed physicians should not expect to receive individual payments directly. The employer organization will receive payments as that billing organization. And so just, if you don't see a payment in your account immediately, do keep that in mind. We are going to be sending out a press release very shortly that's going to include a link to the terms, the full terms and conditions, and information put out by HHS describing this program. And for those of you who want to get to it right away, you can go to hhs.gov/provider-relief /index.html. Okay, that's a mouthful. Just go to the HHS website, look for news releases, and under the homepage, there's a CARES Act Provider Relief link you can click, and that'll get you to the information right away. We will also be sending a link to this information shortly. So that's the first topic that I wanted to cover today. And of course, we'll be happy to answer any questions related to that at the end. The other thing I want to mention is just something that's very important, which is that the Paycheck Protection Program, as many of you know, is now in effect and has been in effect as of last Friday. The Paycheck Protection Program is another provision of the CARES Act that authorizes up to $349 billion in forgivable loans to small businesses to pay their employees during the COVID-19 crisis. And most small businesses, including 501c not-for-profits and physician practices and hospitals, as well as sole proprietorships and self-employed individuals and independent contractors, basically nearly any business with 500 or fewer employees can apply. And the amount that one can receive under the PPP, the Paycheck Protection Program, is up to 2.5 times monthly payroll. And eligible payroll costs are capped at $100,000 on an annualized basis for each employee. So it is important to note that limitation, but this is still an opportunity to receive what could be a very substantial sum of money. It's also worth noting that the total amount of that 2.5 times monthly payroll amount is capped at $10 million as well. But this money can be used to help cover payroll costs and as well as certain other qualified expenses, and it will be forgiven as long as the loan proceeds are used to cover payroll costs and other related expenses, and employee and compensation levels are maintained subject to the conditions of the loan. And one thing that's worth noting here is that again, this is really up to 2.5 times monthly payroll that is primarily intended to cover 8 weeks of payroll cost. The Treasury Department notes that while other expenses are eligible, such as rent and utilities, it anticipates that not more than 25% of the amount of the loan that is forgiven may be used for non-payroll cost, again, such as things like rent and utilities. So this is the primary benefit of this by design is to help cover up to 8 weeks of payroll. But again, this is something that is tremendously beneficial to a lot of physicians, as these are forgivable loans so long as the terms and conditions are met. Something else I want to mention about this, because I feel it's critically important, is that $349 billion sounds like a tremendous amount of money. That's like something like Jeff Bezos' current net worth multiplied by 3. It's a lot of money. But there are also, roughly 30.2 million small businesses in the U.S., according to the Chamber of Commerce, and that includes more than 21 million sole proprietorships. And the average value of the loan, at least as of 6 p.m. Last Friday when the program rolled out, based on the disbursements that had been made at that time, were roughly $314,000 per business. And if you do a little basic math, what you find is that would mean if the average amount of those loans stayed constant until the funds were exhausted, approximately 1.1 million businesses, or about 3.64% of 30.2 million businesses nationwide, would qualify. And even if we generously assume that the value of those loans will drop as relatively smaller businesses apply later, that would still only leave enough funds for a little over 7% of those 30.2 million small businesses, each of which may have an interest in applying for the loans. Now, obviously, that's kind of a back of the envelope calculation, but you get the idea. That money is going to go quick. And if you're interested, you need to contact your lender, visit the SBA's website, speak with your accountant, financial advisor, whoever you trust to give you financial advice, and look into the details of that right away. We've also made this a priority to send out information to our members regarding this program, and we have a lot of information on our site, and we're happy to take questions regarding that as well. But the important thing is to contact your bank or trusted lender as soon as possible to see if they are an eligible lender for this loan program, if you are at all interested. I also want to note that Congress may appropriate additional money for this program, and they have discussed that. Ultimately, at the end of the day, they have provided that it is understood that this money is going to be exhausted, that these $349 billion in funds are going to be oversubscribed. And there is therefore a lot of interest in providing more money for the program. But I cannot not emphasize enough that no additional acts by Congress are guaranteed, and that anyone interested in this program and it should, immediately begin looking into it to see if this is something that they would be interested in and are eligible for. In terms of, I think from what I'm hearing here, we're already getting questions concerning, what the loans can be used for. The Treasury Department has put out a very thorough fact sheet that gets into this in a little more detail, but the specific items enumerated here would be payroll costs, including benefits, interest on mortgage obligations incurred before February 15, 2020, rent, and under lease agreements in force, in force before February 15, 2020, and utilities for which service began before February 15, 2020. And as far as what a payroll cost is, that would include salaries, wages, commissions, or tips capped at $100,000 on an annualized basis for each employee. And there's some other components of that calculation as well. Again, we have a full link to the fact sheet and the interim final rule on our website. And if there is additional need for clarity or information there, I'd be happy to provide that to anybody who needs it. The actual full length of the guidance is a little bit longer. And just for the sake of time, though, that should hopefully give people some indication of what it can be used for. I'm going to take some more of these questions that are coming in at the end. And but one thing that also came up that I thought I covered earlier, but that I want to just sort of reiterate with respect to the $30 billion tranche of funding that is being dispersed as of today. Someone asked whether essentially the hospitals will receive these funds on behalf of their employed physicians, and the answer to that is yes. So just to go ahead and sort of answer a couple of these as we're moving along. So the final program that I want to talk about today is the Medicare Advance Payments Program. Medicare is now offering up to 3 months of Medicare payments, that physicians can receive in advance, within 7 days of applying for them, which is to say, you can receive up to 3 months of Medicare payments. You can receive that money within up to 7 days. And then what it essentially becomes after that is a 7-month loan, a 7-month interest-free loan, wherein payments will become due after 120 days, and wherein the amount must be paid in full within 210 days. Otherwise, certain interest and penalties will accrue. So, this is a really tremendous benefit to a lot of physicians who just need to shore up their cash flow, and being able to receive 3 months of Medicare payments in advance is something that is tremendously beneficial, I think, to a lot of doctors. The full details of this program we also have available on our website. But essentially, in order to be eligible for this, there's not a whole lot of requirements. You have to have billed Medicare for claims within the past 180 days. Prior to the date of the request, not be in bankruptcy, not be under active medical review or program integrity investigation, and not have any outstanding delinquent Medicare payments. You can apply directly through First Coast Service Options. They also have an FAQ guide and a form that you can fill out in order to receive these monies. It's important to note, though, with the Medicare advance payments, and this is different. This is different than the key difference between the $30 billion in funding and the Paycheck Protection Program that I previously mentioned. With respect to these Medicare advance payments, these are not forgivable, which is to say they will have to be paid back. They are not grants. They are essentially, for all intents and purposes, something like a 7-month loan. And in ordinary times, a very generous 7-month loan, 210-day loan would be something that people would consider to be quite an enormous benefit. But it's just important to note that the monies under these Medicare advance payments will have to be repaid, whereas loans taken out under the Paycheck Protection Program may be eligible for forgiveness if the criteria are met. And whereas these $30 billion in payments that HHS is distributing out, as I mentioned, are essentially grants and will not have to be repaid so long as a clinician receiving them agrees with the terms and conditions set forth by HHS. And so those are the programs that I wanted to talk about today. There are other things going on as well, including some guidance in the telehealth space and some other things that we can get into if we have time. But keeping with the overall time of the program that's been scheduled, I want to go ahead and stop right there and kick things over to my colleague, Jeff, to discuss his portion of the program.
Thank you, Jarrod. As you said earlier, the information is coming out fast. It seems like there's a new executive order almost every other day, and there's things that are transpiring that physicians need to know about in order to be able to continue their practice. So what I'm going to focus on are the executive orders that have been issued both by the governor and the Surgeon General, and explain how these affect your practices, and then what the FMA has done to try to help physicians cope with these orders and deal with the aftermath once the COVID-19 emergency has kind of abated. So first, I'm going to start with Executive Order 20-51. It was issued by Governor DeSantis on March 1st. In this, the governor declared the existence of a public health emergency in Florida. And the order directed the state health officer, Dr. Scott Rivkees, who is also the Surgeon General, to take any action necessary to protect the public health, and specifically required him to follow the guidelines that were established by the CDC in establishing protocols to control the spread of the COVID-19 virus and educate the public on the methods of prevention. The order also required the Department of Health to actively monitor all persons who met the definition of a person under investigation, a PUI, for COVID-19 for at least 14 days or until the person tested negative. Active monitoring is to include a risk assessment within 24 hours and twice daily temperature checks. And the Department of Health was also to ensure that all individuals meeting the CDC's definition of PUI are isolated or quarantined for 14 days or until they test negative. This order was followed up on March 9th by Governor DeSantis in Executive Order 20-52. In this order, he declared a state of emergency exist in Florida, and in turn provided this order provided the authority for the governor and the various states agencies to suspend the effect of any statute, rule, or order that would in any way prevent, hinder, or delay any mitigation, response, or recovery action necessarily by the state to cope with the COVID-19 emergency. The order specifically did a couple of things in regards to physician practices. There was a lot of other things that I'm not going to get into because they're not important for this purpose, but it allowed pharmacists to dispense up to a 30-day emergency prescription refill of maintenance medications and allowed medical professionals who are licensed in the state to render services in Florida for the duration of the state of emergency, provided that the services that were provided are free of charge and rendered under the auspices of the Red Cross or the Florida Department of Health. After this, on March 16th, the Florida Surgeon General, Dr. Scott Rivkees, issued emergency order number 20-002. This order further opened up Florida to outside healthcare professionals by allowing any healthcare practitioner who has an unrestricted license in another state. It would allow them to provide both in-person and telehealth services in Florida for 30 days. And unlike the previous executive order by Governor DeSantis, this does not require that these services be provided on a voluntary basis without compensation, or that they have to be done under the auspices of the Red Cross or the Department of Health. In addition to allowing these individuals to provide in-person and telehealth services, it provided that any MD, DO, PA, or ARNP who has designated themselves as a controlled substance prescribing practitioner on the Department of Health website, those individuals may issue a renewal of a controlled substance without having to conduct an in-person physical examination, but only for an existing patient for the purpose of treating chronic non-malignant pain. Telehealth services in this regard may only be substituted for the physical examination. In addition, physicians who are qualified to certify patients for medical marijuana may issue a certification for an existing patient with an existing certification without the need for another in-person physical examination. So you can certify your patients, your existing patients, for a continuation of the medical marijuana they need for another 30-day period. After this order, the governor issued Executive Order 20-72, and this is the order that has by far caused the most consternation and confusion among physicians. Basically, this order requires all physicians and physician practices to immediately cease the performance of elective services. Unfortunately, there wasn't much guidance provided by the Surgeon General of the department as to what was meant by an elective service. So I'm going to read the text of the order to you. It provides that healthcare providers are prohibited from providing any medically unnecessary, non-urgent, or non-emergency procedure or surgery, which, if delayed, does not place a patient's immediate health, safety, or well-being at risk, or will, if delayed, not contribute to the worsening of a serious or life-threatening medical condition. Now, if you go read the whole executive order, the purpose is clear. The governor fully intended that this order was to stop procedures and surgeries that consume badly needed medical supplies, primarily personal protective equipment. Based on the intent of the order and the language as we interpret it, the FMA put together a summary that provided our interpretation of what was allowed. And after we checked with the Department of Health and got sign off, we sent this summary out to our members. In the summary, we were able to confirm that physicians can continue to see patients for purposes of evaluation and management. Telemedicine visits obviously can continue unabated. Primary care physicians can continue to see and treat patients with chronic and acute conditions, perform wellness exams, and provide mental health treatments that do not consume personal protective equipment. And specialists can continue to see patients for follow-up care and other non-surgical purposes. So basically what is prohibited under this order is any elective or non-medically necessary surgical procedure that can be postponed without putting the patient's immediate health, safety, or well-being at risk, and medical procedures that would consume personal protective equipment that can be postponed without putting the patient's immediate well-being in jeopardy. The day after we put this summary out, we received over 200 emails and phone calls from physicians who wanted to know how the order applied to their particular circumstance. Many of these we could answer. Some of those questions we couldn't. So we reached out to the Department of Health for clarification. The department quickly decided they didn't want to answer these questions. And they initially told me that every non-urgent or emergent procedure or surgery was prohibited. And then they stopped taking my calls or responding to my emails. Fortunately, we have some of our staff members who had a good relationship, with the Surgeon General, and we were able to get unofficial clarification that the decision on whether a procedure is in fact necessary would be up to the decision of the individual physician. We also received back channel information from the Board of Medicine that they were not going to discipline a doctor for providing medically necessary care. So our answer to all the questions about can I do X, can I perform Y procedure, is that if based on the patient's current medical condition, if you, the physician, through your informed medical opinion, can say that postponing the proposed procedure will not place the patient's immediate health, safety, or well-being at risk and will not contribute to the worsening of a serious or life-threatening medical condition, you can do that procedure. If you can't so certify, you probably shouldn't do that procedure. However, if the particular procedure does not consume PPE, you can probably continue that procedure. So unfortunately, that's not crystal clear guidance, and we're not able to provide 100% answers with full clarity on whether a particular procedure that you're doing is still allowed. We do have a form that we've created. It's on our website that you can put in the patient's medical records. It basically states that you've come to an informed medical decision that the particular procedure that you're going to do is necessary, is an urgent or emergent procedure, and that it does not consume a PPE. And you put that in the medical records. That's an optional form. It's not required. It's simply there for your protection going forward from any potential discipline down the road or any billing problem that you may encounter with your insurance company. In our conversations with the governor and the Surgeon General, we've highlighted the damage that this particular order is causing and is going to cause physician practices. And we have asked the governor to relax this order as soon as possible and allow physicians to get back to work and treating patients, and keeping their practices viable. The final order I want to discuss is the Safer at Home order. On Wednesday, the governor issued Executive Order 20-91 this last week, the Safer at Home order, which mandates that senior citizens and individuals with a significant underlying medical condition are to stay home and take all measures to limit the risk of exposure to COVID-19. And it provides that all persons in Florida are to limit their movements and personal interactions outside of their home to only those necessary to obtain or provide essential services or conduct essential activities. Now, the list of essential services are numerous. There's probably more things that are included than are excluded. For purposes of this call on what physicians need to know for their practice is that healthcare and everything a physician does, in essence, is a essential service, and that you can continue providing services to your patients as you've done before without interruption, with the caveat being that Executive Order 20-72 that I just discussed is still in effect, so that while your office can remain open under Executive Order 20-91, you still are prohibited from doing a non-medically necessary, urgent, or emergent surgery or procedure during the state of emergency. Now, essential activities under the order encompass attending religious services, participating in recreational activities, most notably fishing, taking care of pets, and caring for or otherwise assisting a loved one or a friend. Gathering in a public space is not an essential activity, and gatherings of more than 10 people are not allowed. This order is going to remain in effect throughout the duration of the state of emergency. So, based on this and specifically 20-72, we had a number of concerns. Obviously, the desire of the governor is to limit personal face-to-face interactions. And so in order to enable our physicians to best be able to care for patients, we felt that it was important that the state of Florida follow the lead of the federal government, specifically CMS, in their Medicare program, and expand the availability and the coverage of telehealth services throughout the state of emergency. So the FMA has sent a number of letters to Commissioner Altmaier asking him to order all insurance companies to provide coverage for a full range of telehealth services, not just the teledoc services that some of the insurers are providing, but full access to all of your treating physicians if such care can be provided via telemedicine, and to allow this to be done through non-public facing formats such as Skype and GoToMeeting. These are not necessarily HIPAA compliant, but the federal government has stated that they're waiving HIPAA requirements for telemedicine for the duration of the state of emergency, and thus the CMS has even extended the authority to conduct audio-only phone calls via telehealth. And so we've asked Commissioner Altmaier to do the same thing in Florida and to provide these services. We sent our first letter on March 19th. We sent a follow-up letter after CMS extended the available telehealth services. And then after the Office of Insurance issued a informational memorandum that accomplished nothing, we did another letter urging them to action. And that finally got their attention. They called us yesterday, and Chris Clark and I had a meeting with them just matter of fact, right before this meeting started, in which they've promised to look into the issues and to get back with us, about how they're going to respond. So we look forward to hearing from them, hopefully next week, as to what the Commissioner of Insurance is going to do in regard to our requests. Additional one that we mentioned was prior authorization. The last letter that we sent, Commissioner Altmaier asked him to order insurance companies to suspend prior authorization requirements, to extend and let current prior authorizations follow changed circumstances. And if they have had issued a prior authorization for a procedure that has to be postponed under Executive Order 20-72, that prior authorization be extended for a period of 6 months. The department has agreed to look into that and to get back with us on that one. The final issue that I want to talk to in relation to the executive order is the potential liability that physicians' practices will face under Executive Order 20-72. Physicians are going to be charged with making the tough decision as to whether a procedure or surgery needs to be postponed. Some of these things, like testing, like mammograms, you don't really know whether it's a necessary procedure until you've done the procedure. And so you're having to make a difficult decision on whether this should be postponed or not, which could, if you decide to postpone something only to find out, 4 months later that you probably, that condition did exist that necessitated, quicker treatment, you're going to face a potential lawsuit. So we've asked Governor DeSantis to provide medical liability protections for physicians that are affected, by this order, and not only, by postponing procedures, but having staff and patients come into places without a sufficient amount of PPE and the potential exposure and liability that may exist there. So we've asked Governor DeSantis to issue an order extending existing liability protections, most notably the Good Samaritan Act. We've asked him to delete the provision that requires that care be provided without compensation, and we've asked him to change the standard of care for liability. We've also asked him to look into extending sovereign immunity protections, and also to just flat out extending immunity to all physicians providing care during the existence of the executive order. So we've received word from the governor's office that these recommendations have been well received, that he is indeed has an intention of issuing something. We hoped it would have been out already, but the word that we're getting is that such an order will be forthcoming soon. So, these are the things that the FMA has been involved in and continue to advocate for physicians. And at this time, that's all I have. So if anybody has any questions, I'd be glad to answer them.
Well, I want to thank both Jeff and Jarrod and point out this situation is changing daily, and the FMA will continue to pursue efforts to get relief for our doctors. And as new federal programs become available, we will see if they are applicable to ask our state to put something together comparable on the state level. And we have about a dozen questions. They all seem excellent. A few of them have already been covered, but we will go through them again. Matt, would you like to read the questions in order? I can answer one real quickly. Someone was asking about the new grant program. No application is necessary. If you have been paid by Medicare, the money is many doctors. It's already put in the bank this morning electronically. No application is needed. I can tell you, I filed no application for that, and to my great relief, I had an entry in my bank account this morning, and it's clearly labeled relief, and so you know exactly where this money is coming from if you see a new deposit in your account. So with that, Matt, would you want to go to the beginning of the questions? You want to read them off?
Yes, sir. The first one is from Dr. Fred Barr. What exactly can we spend if we are fortunate enough to receive CARES loans, the forgivable loans on? Please be detailed in response. What type of taxes, utilities, etc.? Thank you for holding these webinars.
Yes, so I think I addressed that question briefly earlier. The matter is that, you know, in the time that we have today, we can't get into all the guidance that the Treasury Department has issued with respect to everything the loans can be used for. However, you know, this is one of those situations where if you email me directly or email the FMA directly, I can send you the interim final rule and I can send you the guidance sheet that the Treasury Department has created. I would also say that with respect to this program, it's worth noting that a $349 billion program being rolled out this quickly is unheard of. And it turns out that many of the lenders, when they first received guidance under the Paycheck Protection Program, felt that some of the guidance that the Treasury Department has issued is, you know, really not perfectly crystal clear. It will therefore also be important to check with your SBA qualified lender, you know, and keep in mind many lenders meet that criteria. So with your bank or with your other lender that you're going through to receive information on the terms and conditions of the loan, in addition to, you know, whoever your accountant or financial consultant is. The broad categories of items that these loans may be used to cover include payroll costs, which include certain employee benefits for vacation, parental, family, medical, and sick leave, allowances for separation or dismissal, payments required for the provisions of group health benefits, including insurance premiums, and payment for any retirement benefit. Additionally, insurance outside of payroll cost, interest on mortgage obligations incurred before February 15, 2020, rent under lease agreements in force before February 15, 2020, and utilities for which services began before February 15, 2020. It's also worth noting that respect to the payroll cost calculation, wages, salaries, and commissions are capped at $100,000 on an annualized basis for each employee. One thing that's also you know, worth noting here is that included in the you know, in the term payroll cost, the Treasury Department notes that state and local taxes assessed on compensation are you know, an item that falls under that. But you know, like, that begs many more questions, and we don't have time to cover the complete guidance here. And again, some of this information may be subject to change or clarification by the Treasury Department. And so at the end of the day, the best that I can do for you, if you were to visit our website and click on our article regarding the Paycheck Program, it has a link to the official guidance from the U.S. Treasury Department and to the official interim final rule. And additionally, if you email us, I can provide you with direct links to that as well. And, you know, we can work to clarify any questions you have. I also highly recommend, again, that you inquire immediately with your lender, you know, for more information, as more information from the Treasury Department may be provided to lenders, you know, in the near future. And also to have your financial advisor or whomever check on the SBA website as well, and on the Treasury Department website, as well as literally new guidance for this program has been issued on multiple occasions since the release of the initial information that came out providing the loans. Keep in mind, you know, so this program rolled out last Friday, right? The Friday before that, a $2.2 trillion law was passed. And so something that, you know, we can't reiterate, we can't reiterate enough is that new information is constantly coming in, and some of the guidance that has been provided, again, may be expounded upon. And that with respect to this, these calculations specifically, they're fairly complex. And so, again, it would be in order to get the full details and information, I can send a link to the official guidance from the Treasury Department. And, would certainly suggest, though, that anybody interested also inquire immediately with their SBA qualified lender for additional information as well.
Thank you, Jarrod. We're going to move on to the next question here. From Dr. David Robinson, are there any payments for pediatricians who do not use Medicare?
Good question. So the $30 billion tranche of money that was dispensed today is based on Medicare fee-for-service billings. And so that is obviously limited to providers who bill primarily for insurance programs other than Medicare fee-for-service. So only Medicare fee-for-service funds are used for the purposes of determining that the money that will be distributed under that $30 billion tranche. I want to note that Medicare Advantage payments also do not qualify. I think that's another question that we have later along. So it's just money under Medicare fee-for-service that's used for the purpose of making that calculation. However, pediatricians and other physician practices that may not bill much in the way of Medicare are still eligible to apply for the Paycheck Protection Program, which again can include up to 2.5 months worth of payroll expenses. And in addition, to that, there may be other relief that is forthcoming as well. This initial $30 billion tranche still leaves $70 billion to be dispensed later. So it is a possibility that additional programs may become available that would be worthwhile along the road. And, for additional information too on other things that may be of help, such as some changes to the telehealth billing requirements that have taken place both under Medicare and in some cases with private payers as well. We have information regarding that on our website, and we would encourage you to reach out.
Okay, then next we have a question from Dr. Mara Saveshik. Do hospitals receive the HHS funds on behalf of employed physicians?
So that is another good question. And the answer to that, according to the guidance that has been released here, is essentially yes, is the short answer to that. Employed physicians should not expect to receive an individual payment directly. The employer organization, the hospital, for instance, would receive the relief fund as the billing organization, as the information provided by HHS.
Okay, the next is from Dr. Dan Mearson. Will we be getting an email that tells us how to attest for the grant we have received?
Yes, we will provide additional information on that as soon as possible, including a link to the terms and conditions form that is available on HHS's website. We intend to provide that information as soon as possible, possibly today. And certainly if any new information becomes available, we will do our best to keep people up to date. I would also advise at this time, if you have not already, it may also be worthwhile to sign up for the provider newsletter through CMS, which is free to sign up for, and they tend to do a pretty good job of sending out updates as well that include a lot of this information as quickly as it's released. And again, of course, you can count on us to advocate for you and to continue releasing information as quickly as it reaches us and is digested.
Okay, Dr. Nolman had a question that I believe Dr. Giffler already answered about if payments were automatic. The next one is from Dr. Suyeon Lee. She's asking, banks are not taking in PPA applications as they're already overwhelmed with applications. And I can actually answer that because I was talking to our corporate banker earlier today. He suggested that you actually go first to community or smaller banks, as they tend to be seeing better results from this, and then go to the national ones if you cannot find something locally, is the advice that we've been getting. Then another one from Dr. Lee. Jarrod, what other similar programs do you know of? Thanks.
So the three programs I mentioned today, first the $30 billion tranche of money that is being dispersed by HHS in the form of what effectively amount to grants. Second, there's the Paycheck Protection Program, which are loans which are potentially forgivable. And third, in addition to that, there are Medicare payment advances of up to 3 months available, although those payments do have to be repaid within 210 days. In terms of whether or not more grants are being made available, or whether or not more grants, will be made available at a later date, the answer to that is it's indeterminate. HHS still has $70 billion worth of funding to disperse. Theoretically, they may provide more grants to providers, but that's far from assured. A lot of that is going to just be determined in the coming weeks and months, and understand that we're fighting to provide as much relief for physicians as we possibly can. If you had questions about some other sort of program or guidance that you've seen, please do let me me know, though. There's a lot of information out there that we post on our website on a lot of different types of regulatory relief that have been provided by CMS as well, that may not be in the form of grants per se, but just know that there is more information out there that may be pertinent, and also information on other types of loan programs as well that may not have the same level of generous terms, but may nevertheless be worth applying for in the form of more standard interest-bearing loans. So if clarification is needed at all, again, just send us an email, and we can send you to the appropriate resources, and I'd be happy to clarify that further if needed.
Thank you. Next one is from Stephanie Namey. Does the payment from HHS solely based on claims to CMS, or does it also include Medicare Advantage claims? And secondly, is this a one-time payment included in the practice income?
So I'm not sure I understand the second part of that question, but the answer to the first part is that this is based solely on Medicare fee-for-service payments. It does not include Medicare Advantage payments. We understand that is problematic to many of our doctors who are in MA-heavy areas like Miami and so forth, but this is solely based on Medicare fee-for-service payments from HHS or from made by Medicare.
Jarrod, I think the question might be rephrased. Is this grant money, will this be taxable as income?
Oh, that's a good question. There is no indication of that provided in the guidance provided by HHS. It doesn't mention whether it is taxable or not. So in the absence of additional guidance there, that is a great question, one that we will research. And Stephanie, I know that you and I have communicated in the past on some other payment issues, and that is a good question. Since I don't have information on that at the time being, allow me to do some research and see if I can find an answer to that.
And on the payroll protection, if that's a loan forgiven loans are frequently taxable as income as well.
Yeah, no, that's a great question related to the taxation question. I don't know the answer to the taxation component, and that's an extremely important question that I hadn't heard so far before. So I'm actually glad that that's been brought up, because that is something that we'll need to research and see if we can provide information on, because I appreciate that the taxable component of that is something that is an important consideration whenever borrowing or receiving money. And since I don't have an answer to that, I will work to get that and make sure that we update our forms on our website accordingly with the answer.
I guess we should have brought on some of our financial and tax people. Has there been next one? Questions for Jeff. Has there been developments in malpractice forgiveness, especially in cases of physicians who volunteer for COVID-19 services, but also in context of cessation of elective surgeries?
Yeah, I only know about the doctor's company. That's the FMA endorsed insurance company, and I'm aware of their policies. They've announced that they are covering telehealth. So if you've never provided telehealth before and you start doing it now, you're automatically covered. You don't need to do anything extra. If you are a retired physician and you are volunteering to go back into service, TDC will provide coverage to you at no cost. And if you are suspending your practice because of Executive Order 2072, then TDC will suspend coverage on your policy, which also means that they'll suspend any premium that's due. If you are changing your practice because you can't do any elective procedures, contact TDC, and they have said that they will work with you on adjusting your premium based on your decreased exposure. So as far as what other insurance companies are doing, I don't know, but I know that TDC is certainly willing to work with all physicians.
Okay, the next one's for Jeff too. One notification stated that any office visit was considered a procedure for the purpose of the executive order. Is that interpretation correct? If so, does that mean that the office visits must also meet the emergent or serious criteria?
Like we said, we struggled over what procedure means and tried to get clarification from the department on exactly what's included and what's not. And they flat aren't going to tell us on a case-by-case basis whether something is a procedure such that it's prohibited if it's not medically necessary. So that forced us to go to the dictionary definition, and basically a procedure is anything a physician does. So if you are seeing patients in your office, that is a procedure. Now, that doesn't mean it's prohibited. Then you have to look at whether it's a urgent or emergent procedure, or whether it consumes PPE. And so the best thing that we can tell you is if you are doing a procedure that does not consume PPE, you're probably okay. If you're consuming PPE and it's not a urgent or emergent procedure, then don't do it.
Okay, next question is from Cynthia White, MD. Did you just say that CMS is allowing telephone audio-only visits? If so, how do you bill telephone? 9941 to 99443.
The answer is that CMS is now providing payment for those audio-only telehealth or telephonic codes 99441 through 99443, and we do have the coding guidance available on our website. Keep in mind, though, that these codes tend to reimburse at between somewhere around $14 to $42 per code. So they do not reimburse at the amount of other types of E&M codes, which continue to require both audio and video capabilities in order to perform. And so do keep in mind the reduced valuations for those codes. And again, I can send a link out, and we do have available on our website a full guide that explains what types of telehealth services to bill for and the appropriate coding guidelines, including for 99441 and 99443.
Okay, I have another question that's a follow-up on the question about HHS funds going to employers. Legally, what does this mean for furloughed physicians without pay where the institution has received HHS funds on their behalf?
I don't see any guidance on that in the HHS information that's been provided here. They simply said that employed physicians shouldn't respect the payment, that the payment would go to the employer organization. That is not something that I have had time to give any consideration to, so that is something that we'll have to look into. But again, what I can say is that according to the guidance that's been put out, employed physicians should not expect to receive an individual payment. That payment will be provided to the billing organization. I would also note that this program, literally the guidance was released this morning. And something that I've noticed ever since this COVID-19 stuff started rolling out is in many cases the guidance that's been issued by CMS, HHS, Treasury Department, whatever, is sometimes it's less than complete. And in this case, the information that's provided by HHS pertaining to this program is about the equivalent of maybe 2 pages, size 11 font, double spaced. And, they have a terms and conditions sheet that is, substantially longer, but a lot of that seems to consist primarily of what you're excluded from spending the money on. And some other things related to surprise medical billing. So that's a great question. I don't have an answer to that offhand, but I will research that as well. That's a good question.
I would add that if you are a physician who's been furloughed without pay and your employer has received funds in recognition or in response to the services that you provided, I would contact your employer and ask them to reconsider the fact that you're not being paid, because you may have certain legal theories under which you could bring a cause of action against your employer for withholding funds from you. So certainly, if you find yourself in that situation, contact me here at the FMA, and I'll be glad to walk you through that.
I'd like to add that chances are your employer also applied for a payroll protection program, which is a much larger dollar amount typically. And there are provisions there that if they don't maintain their payroll, they will have less of their loan forgiven. So there's a financial incentive to maintain their payroll, their employees.
That's a very good point as well, Dr. Giffler.
All right. Next question. I think, Jarrod, you might have covered this, but I'll give it again. Where can we get more information regarding the new program you learned about? It was just announced this morning, meaning the grant.
Outstanding. So we're going to be sending out an email to all the physicians on our newsletter, all the physicians who subscribe to our newsletter shortly. But if you want to try and get access to information right away, go to hhs.gov. And the way to find it is going to be going from home to CARES Act Provider Relief Fund. HHS's website is, like a lot of government websites, it's not, very well laid out, but that information is available there on the website at hhs.gov.
Okay, the next question is from Dr. Yvonne Scherer. Are contract employees included in payroll costs?
Contract, are we talking about independent contractors? So there is guidance on that, and it's under, I have the rule here right in front of me, so let me get to that because I know that that's covered. And the bottom line is let me send that information out separately because I don't remember all the details off the top of my head, but there is an answer to that is provided for in the guidance, and I can provide that in writing to whoever it is that's asking that question. I'll make sure that I get your.
Dr. Scherer also asked, is there a full list of lenders?
So the SBA actually does include information on lenders on their website, but one thing to keep in mind too is that if you're not sure, there are a tremendous number of organizations that are providing these Paycheck Protection Act loan or Paycheck Protection Program loans rather, and therefore it might be worth calling whatever bank or lender that you ordinarily go through to see if they're not a qualified lender as it stands. There are a tremendous number of entities that meet that criteria.
Okay, the next one's from Dr. John Hemstreet. This one's probably for Jeff. When will we know if we'll be receiving full parity for telehealth visits for private insurers? Our practice so far received full payment from Blue Cross Blue Shield, but similar 99213 Cigna discounted out our payments about 30%. We're concerned about Humana, Aetna, and United as we're seeing many patients via video visits, but unsure if we will be fully paid.
Yeah, that's exactly the conversation we had with the staff over at the Department of Insurance. We pointed out that Florida Blue seems to be paying at the right rate, but we were certainly unsure about the other insurers. And this is good information that kind of validates what we told them. We've asked them to cover it at the same as the in-person rate. They have indicated that they will look into this and get back to us next week. They've been sitting on this for a while, so I'm sure that the insurers are putting pressure on them not to act, but we're going to continue pressing them to do the right thing. So hopefully we'll have an answer from them next week.
And Dr. Hemstreet, anybody else on the call, if you can send us that info a little better quantified, we can actually forward that on to the insurance folks, and that would be very helpful if we had examples of the insurance companies doing that. The next question here is from Dr. Richard Sadov. Dentists are supposed to be released from the executive order on May 8th. Is it likely that physicians will be released from elective procedures at the same time?
Well, it's going to be the same for everyone. I mean, the dentists haven't been singled out for an early release or a release different from what physicians are experiencing. So the executive order expires 60 days from March 9th. So at that point, the dentist is going to have to make a decision on whether he extends it or not. If he does not extend it, then everyone will be free to resume elective procedures.
Okay, the next is from Dr. Stephanie Namey, and she says the loan forgiveness is considered non-taxable income. So that's good to know. And then after that, we have Dr. Dan McDyer. He is a member of a large group of OBGYNs. We're each employees of our own care center. Will the grant be forwarded to our large organization or the individual care centers that employ the physician?
Yeah, so that's a good question. And HHS does offer some degree of guidance on that. Let me, provide for what it says with respect to, quote, large organizations and health systems with respect to how they receive the fund. It says large organizations will receive relief payments for each of their billing TINs that bill Medicare. Each organization should look to the part of their organization that bills Medicare to identify details on Medicare payments for 2019 or to identify the accounts where they should expect relief payments. And going back to a question that was asked a moment ago, and I don't know if this is quite going to cover it, but I do want to note in the interim final rule, there's a Q&A included within that. And again, we can send you this document that asks, do independent contractors count as employees for the purposes of the Paycheck Protection Program loan calculations? The answer provided by the Treasury Department is no. Independent contractors have the ability to apply for the Paycheck Protection Program loan on their own. So they do not count for purposes of a borrower's Paycheck Protection Program loan calculation. So there's that.
Okay. Next question's a follow-up from Dr. John Hemstreet. We have many successful video visit calls, but on at least 25% the video deteriorates and the calls continue by phone. It seems it should be billed as a video visit, not the lower reimbursed telephone call. Thoughts?
If I understood the question, I think the answer is that we would agree with you. We don't agree that audio-only telephone calls should be reimbursed at anything less than the full in-person rate. However, and we are encouraging CMS and HHS to take that action. We're also planning any future actions taken by Congress to try to mandate that. But all I can say is as far as my thoughts is that I agree wholeheartedly. I think that it's an absurdity to sit there and say that you're performing all this labor that takes just as much time and just as much knowledge and everything else, and in exchange for supplying that labor to be reimbursed a lesser amount is unfair.
Okay, we have one last question here. Then any other questions or follow-ups anybody have, be sure to email us at membership@flmedical.org, and that is membership@flmedical.org. This last question is from Dr. Cynthia White. Any information for people who are repaying medical school loans?
With respect to the CARES Act, yes, there are there is some information there related to university loans or student loans. And I can't remember that information off the top of my head, but I can tell you that I will email that information to the person who asked the question, because I do know that there is some relief provided in terms of suspending payments for certain types of student loans for a set amount of time, but I can't remember offhand the parameters for that. And so I will email that information in response.
All right. Well, thank you very much. And we will be doing these webinars somewhat frequently, so be on the lookout for more invites. And like I said, any questions or follow-up that anybody has, feel free to email us anytime at membership@flmedical.org. And Dr. Giffler, did you have a couple more words?
I would just like to thank everyone, participants, both from our staff and member participants. There's a tremendous amount of information coming at us from the government, from our hospital staffs, from our specialty societies, from all sorts of journals and information on the email. But you are our best eyes and ears to let us know what's going around the state. There are so many different insurance plans and employers, and so please, if you have any issues or concerns, let us know, and thank you all very much.
Oh, and just while we're still technically on the line, for medical students, with respect to the loan provision, I do want to go ahead and note that there is essentially going to be a brief suspension for payments under the CARES Act provided for medical student loans. And again, we have a full fact sheet that kind of explains that, that's included on our website, but we'll make sure that we send out information on that as well. So thank you.
One thing I'd like to reiterate a question. Do not be discouraged if you don't see your bank listed under the heading of the SBA loan banks. There are many, many more banks that are participants than are listed on the website. Ask your bank.